The booklet emphasizes individual efforts to maintain mental health and well-being, addressing common misconceptions that mental health only concerns those facing challenges.
President at RG Car Institute at Kolkata. We talk of mental health at workplaces. There are a lot of medical professionals here. Have we failed the system by looking at the mental health of the people who run our hospitals? Have we failed ourselves in the first place? That needs to be thought of. If you go around the country and look at the working conditions of the residents, nothing has changed. It is pathetic. So we talk of occupational health, we talk of mental health, but we don't look at our own backyard. So yes, panel discussions are important, conferences are important, even committees are important. Honorable Supreme Court has prepared a national task force which is meeting frequently. I'm also part of one of the committees along with Dr. Pratima, and we've had 4 meetings. We'll bring out a report as well. Will that change things on the ground? That's the important question. What we discuss here, will it lead to any change in the ground? We have a person from the industry, in fact 2 of them. One of them is talking of capital mobilization as far as resilience at workplaces is concerned. When will the government start thinking of motivating its own workforce? Will we let them work in the conditions they are? And since this is a program of the government, I think this thought has to come to the policy makers, whether we are looking at the mental health of our own people working in our own sector for the government of India. Pass on this mic to Mr. Siddharth Bhattacharya, who is sitting next to me, where again the question is, what role does industry bodies and associations play in advocating for better mental health policies, and how can the government initiatives and corporate policies align to create a more robust framework for mental health at work? Again, you are from the corporate sector, but I would like you to talk about certain initiatives that the government needs to take place, needs to develop for looking at the mental health of its own workforce. So we are not looking at only the industry, the government workforce as well.
So thank you, sir. Thank you, sir, for that, setting that context. The topic of discussion is very, very close to my heart, as well as probably one of the most, silent epidemics that we will be facing in the coming years. We already have started seeing what some incidents which you referred a couple of months back. About 150 million, probably the environment has 150 million mental health. People who require mental health assistance. Nearly 75, 3 out of 4 are undiagnosed or untreated. And we have a scale problem, we have a reach problem, and I think some of the announcements made earlier today are steps in the right direction. A lot more we'll have to do, and together with government and private sector.
Prevention is making an improvement or not. There are a lot of data related and privacy related issues that limits a person from generating evidence in Indian context. So I do not have the answer to say that what really works, because we do not have a published evidence. We do not have a published evidence.
Okay. Thank you, Dr. You would make a mention of the various aspects that need to be considered while formulating policies for fostering employee mental health and resilience at workplaces from the perspectives of an employee as well as the society.
So just start, I think, Dr. Goel, when you mentioned about what's the point of conversation if it doesn't convert into action, and if the action doesn't convert into something, I mean, as simple as that. I'm sitting here, I'm sitting here, so there are a lot more from my side of the world, experts who know a lot more are sitting on the other side. But I've been 25 odd years now in private practice. I'll say it how I see it. I just don't feel mental health has been a priority. I think we're beating around the bush if we think that we've made it a priority. I think private sector largely has failed mental health more than anything else. Whether it's private sector in the healthcare provider segment, whether it is the private sector in the corporate segment, you can't start a conversation by what we can do until you also accept what we've not done. And that has to be a very clear understanding. You walk into a healthcare provider tertiary care network today, and you will not find an integrated mental health program, right? If you are not going to talk about cardiac surgery or neurosurgery or trauma, and if you don't integrate a mental health component there, then what in the name of health are we doing that? Look at one preventive health program and see how many of them have integrated mental health. That's a fact. The second part is this whole aspect of what the industry can do. The industry needs to start by saying it's not done much, rather than enumerating what it has done, because it's just pointless. We keep talking about the need of impact, even evidence for that matter, sir. I don't see it like that. Human right doesn't require evidence. Mental health is a human right. Now, whether you provide for the mental health and does it help your bottom line or top line or not is all secondary business. First, get your human rights on track. And that has to be the case. Now, whether it is when you said in terms of the mental health professionals or anybody working for that matter at any level, and that intent has to be there. In fact, I just feel our intent doesn't last. I mean, we have these conversations which are lovely, right? We just don't last through the 365 days. Although, I mean, to be very honest on this, I was just telling this to Bhavuk. My take on Tele-Manas is that probably it is the most significant, impactful initiative globally that our mental health has seen. And I truly believe that over the next decade or so, the world will realize the sheer impact of Tele-Manas. So anybody and everybody who's involved in Tele-Manas, just take a bow, because you do not know the impact of what you are doing. We run a very smallish crisis intervention helpline for under a decade, right? I know what it takes to run it 24/7, where clinicians out of their own time spend time. I am on that helpline several times a month. But to do beats the private approach to mental health, hands down, right? And that has to be the case. I mean, if you ask me, the thing that we'll never forget is the Honorable Finance Minister's speech on budget when mental health was spoken. I would have never thought in my lifetime I'd hear the word mental health in a budget speech. Right? So the government, in my opinion, sitting from the private sector, is walking the talk, and it's walking the talk big time. The Tele-Manas absolutely remarkable. I see it changing the landscape of mental health probably in a decade or so globally. Because people will learn, this is your efficacy, this is your evidence. And the evidence is about outreach. We keep talking about the fact that we don't have enough people. But we don't realize we also have one of the most robust digital transformations that any country has seen globally again. Digital India is our power. Tele-Manas has shown that. The fact is how many, several lakh people have taken advantage, including psychiatry. I mean, what remarkable that is. Now you compare the data of Tele-Manas to a data of a leading private healthcare organization. I mean, it should shame us. And that's because we keep coming back to what it does to the bottom line and the top line. And that's why I believe mental health needs to be seen as a human right. Until we don't see mental health as a human right, and I know You spend $1, you get $4 in return for mental health. All that is fine. But the fact is, if you don't see it as a human right, the rest is all just whataboutery. We need awareness in a sustained way. Awareness cannot happen intermittent, and awareness cannot happen if all stakeholders don't take part in it.
And I've seen everyone is expert here, so I'll try to bring in some employee and workplace perspective to the conversation. There's no doubt that about the correlation between the productivity and mental health. Though we do not have specific kind of matrices or statistics which talk about that how mental health impacts at organizational level, but we do have some overall statistics which talk about how mental health impacts the economy. So the World Health Organization, it estimates that between 2012 to 2030, India could have like estimated loss of $1 trillion USD because of mental health conditions. So now coming to the policy framework, so I'll reflect on the policies with the question that have been asked, that we do have some key policies and frameworks that provide foundation for promoting mental health at workplace. We do have national mental health policy, which outlines the broad vision for mental health and also advocates for integration of mental health into general healthcare at workplace. Then we do have some Mental Health Act 2017, which provides mental health rights and also emphasizes the importance of providing supportive environment for employees in the workplace. Then we have Factories Act, which is about large workplaces, especially the factories, and mandates to include mental health services under expanded interpretation for employee welfare. Then we do have CSR, wherein we have ambit of funding mental health interventions. But beyond that, when we talk about mental health in the organizations, we see that mental health policies in organizations are very fragmented, though we have growing policy framework. But when we talk about the challenges, it's mostly about the implementation. We do have, in large corporates, we do have some kind of programs, but which are more to the perspective of compliance. But when we say that integration of these policies or these kind of programs at the broad organization strategy level, we do not see that. For example, in organizations, when I report to my managers or other people, if they do not understand the concept of mental health, so how do I can ensure or maybe talk about these issues at workplace? Very small, loosely related anecdote. My dad, who served in public bank for last 30 years, amazing dad, and like all the girls would say, very diplomatically cool. But when I go to him, tell him it's about anxiety, थोड़ा anxiety हो रही है, he'll be like, steel का दिमाग बनाओ, ये सब कुछ नहीं होता है. And I'm like, okay, thank God you're not my manager, right? So it is mostly also about systems around mental health and how organizations adopt in their business systems. For us, when I cannot go to my managers or my leaders, I cannot talk about it. And I'm spending there 8 to 10 hours. So how do I deal with it? And also, through the career, we as managers also are never trained in our leadership skills or anything, that how do we act with people around us, or how do we become the first responders and provide that support. Also, throughout my education or the employment, I would say that I've never learned that when do I seek help? So there have been small kind of stresses and all of that. But where do I learn that, okay, this is the point where I need help? Or how do I be the first responder? And each day, for example, last year someone came to me and they were like, I'm feeling differently, and they shared the issue with me, they're professionally close. And then I was like, okay, what do I do now? Because through rolling on the Instagram, I read somewhere that you do not say that don't worry, everything will be okay. That is the worst statement to say to someone. But what do I say to them? I cannot reach out to their family because I don't know how they react. And that's the cause of my problem now, that what if something happens to them? So we are not prepared at any level also. So with the 3 components that I see, right, 3 A's that I talk about, wherein awareness, accessibility, and accountability, we lack awareness. we do not know when to seek help. We do not know where to seek help. In rural areas where I can come from, I do not hear people talking about it. Even if you say that, okay, I have some issue, they'll be like, "Dimag kharab ho gaya again." And when you say, "Haan, actually mein ho gaya," they wouldn't understand that. So similarly, the accessibility with Tele-Manas, accessibility is increasing. But again, it then accountability for it from my managers, from the people that I'm around. Nowadays, because of we're losing those social connects around our families, we spend most of the time in our offices, and then later thinking about the offices, working about the work. So that's the
Basically observed is a reflection of general population prevalence rates. It's more or less the same, depression around 4 to 7%. Work stress is one thing that we have dealt in, more harmful levels of work stress across different populations. The government workers having a higher levels of work stress, somewhere around 15 to 16%. Most of the IT employees where we studied has generally believed that they are highly stressed. I never got more than 12% in any of the IT companies that we used our TOS. We have studied some nurses working in a multicentric study of nurses in the state of Karnataka who are working in pediatric ICUs. We got more than 33%. A postgraduate study on health administrators in hospitals in Bangalore. They could be hospital administrators, nursing matrons, basically doing an administrative work in a hospital, both from private and government sectors. The stress levels was increasingly high.
Good morning, everyone. I'm Dr. Ankur Sasteva, Professor Psychiatry at ESM Medical College, Ahmedabad. I'm representing Ministry of Labour and Employment today. So my question is to Dr. Gautam here. So you've spoken very well about the issues and the policies that are pertinent in the organized sectors. My more than question, it's my query to you. For example, you've assessed the workplace stress at different factories or different organizations. So I'm sure you must have done it cross-sectionally. But once you come back, how often do you think the companies engage with the same process and they follow up with that? Because I don't see it happening. We have been associated with multiple factories in Faridabad, and we do these scams and mobile clinics. But I don't see them making difference because I don't see any initiative from the companies or the organizations to follow it up. So what is your take on that?
Yeah, so that's exactly what I'm trying to say. Unless all the workplaces, especially the manufacturing sector, they work on a compliance mode. The occupational health system is the outgoing part of the company where money is going away. They don't believe it's a partner in productivity. Since it is not a mandate in the Factories Act or currently the OSH code, the sustenance is not there in many workplaces that we see. But many workplaces that I have seen, my experience is limited, but they do take it as a sustainable mode because they have some global policies to fulfill. They have some.
And Ms. Swati Jha, Program Director, Jan Sahas. I'd also like to now request Mr. Saurabh Jain to felicitate Dr. Pratima.
Grateful to ASNMD, JS Policy and Director HM2, Dr. Neha here for giving me this opportunity. A very warm welcome once again to all my fellow panelists. So, as we all know that in the previous panels which we heard in the morning and also during the inaugural session, we have discussed the important policies and frameworks. National Mental Health Policy, that aims to promote mental health, reduce stigma, foster inclusivity to prevent and recover from mental illnesses. We have also explored challenges, opportunities and innovative solutions also in informal workplace in the previous panel which we all heard. And of course the Tele-Manas, success of Tele-Manas, and it's really we feel very happy that NIMHANS, NHSRC and IIIT Bengaluru, three initially along we worked on the directions of Ministry of Health and formulated initial guidelines and large success, really very heartening for that. All these services are now being part of comprehensive primary health care, and we heard Dr. Bhavuk talk about that Ayushman Arogya Mandir. So I must share with you that in last couple of years we have had more than 4 crore sessions of wellness sessions, and 55 crore people in the country have attended these wellness sessions. Although it's difficult to quantify preventive and promotive actions, that's why public health doesn't get that kind of mileage or leverage what the clinical specialties get. But here, at least we have the numbers which can later on leveraging technology see that what is the incidence overall subsequently in following years to come. So that's another success of this Ayushman Arogya Mandir. So this panel will shift our focus to. We've heard what all to be done, what are the challenges. This panel will shift our focus to what is to be done in preventive as such, care as such, the life cycle approach, the primary prevention, secondary prevention, and also tertiary prevention, looking at all levels. And the formal workplace, what we mentioned, we are focusing today, but it's also linked with outside our workplace also. Our social networks, our hobbies or lack of hobbies, social activities, education, intimate relationships, family, peer acceptance, financial situation, access to healthcare. So all that issues also are probably linked with our workplace too, because they have the effect also in case the workplace challenges are there. So we need to I would like to highlight two, three more important issues before I start the panel discussion. One is, though we say formal, but as per the information available, there are more than 17 kinds of formal workplaces as such. Each has its own unique challenges. So that's why there's no one size fits all guidelines or policies which can be there. We need to understand the workplace culture which varies from one to another. I'm not going to list all those 17, we can have list subsequently as such. Then again, there are various types of employees also. Regular, contractual, part-time, we all know that. Again, each has its own challenges. The kind of, the assured career progression which one set has, the other one doesn't have. This is just one example which I am giving you. There are types of work we all know, what all various ranges and all, even within the formal. And the other is the prevalence of various factors at the workplace, which were discussed in the previous two sessions. But just to highlight few, the workplace bullying, stress, job insecurity, hazardous working conditions, inadequate support, glorification of the hustle culture which has now come up, workaholism. We all take pride that we work for long hours, and we can contact our team members any time of the day, any time of the week, any time of the 24/7 to 365. That's something which has become ingrained in us. So and we need to now address those issues also, and it leads to a lot of issues which we all are aware. But the burnout and all which we commonly say, one doesn't even come to know about it. It's a gradual process which seeps in, and suddenly one day you realize what has happened. And of course, the irritability, the minor issues, stress, depression, and all, which are very common, for which no one goes and consults anyone. That's why Tele-Manas is going to be a great help for all this. And they're just highlighting that substance use and misuse, which can both be a precursor or an outcome as such, and of course, impact the life as such. Literature is available. I'll highlight two studies which are there, and I'm warning the data, will mention the data are not available. I think two important studies are available. A review of various studies which assess the prevalence of NCDs and mental health in Indian workplace after COVID found that 10 to 53% workers suffered from depression, 7 to 57% suffered from anxiety, and 4 to 76% suffered from workplace stress. The range is large because the study designs were different, sample sizes were different. But one study from Deloitte, one of the big four Deloitte, and which we talk about mental health and well-being in workplace in 2022, found that 80% of these workers suffered from something or the other. 59%, most common, 59% depression, emotional exhaustion or burnout 55%, irritability or anger 51%, sleep issues 50%, anxiety 49%. That's a large number. And we all know what happened to 26-year-old employee of Ernst & Young Global Limited recently. On the other spectrum is Mr. Nayan would be talking about 70-hour work culture, whereas in Western world they are talking of reducing the work culture, 30 hours, maybe lesser than that, and switching off post after a certain time every day. So we need to again probably discuss that too here as such. The work culture and the preventive approaches. So I would request, all my fellow panelists to, when they share their ideas, that, they focus on broad principles which are solution-centric, action-oriented and innovative. Because we need to come up with a plan after the session that how it is to be done, what is exactly to be done here. So I will start with Dr. Raghu. So if you could, kindly elucidate what is the role of government policies or programs, initiatives and healthcare facilities in promoting indigenous practices and holistic approaches for mental health mental health at the workplace. You could also probably add the 12,500 odd arms. What could specifically be done?
Thank you, eminent chair, Professor Adul Kotwalji, other co-panelists. It is a really important issue that we are actually discussing, specifically in the context of preventive and promotive aspects of mental health work, how the traditional medical practices as well as other cultural practices have, how it can become an impact in defining the health outcomes in the context of the mental health. So, as far as the national policy itself is concerned, actually there is a very specific action is actually provided. Is to integrate the yoga at the workplace, to
promoting mental health among employees and also society at large.
Thank you, sir. Thank you for inviting me to this conversation, sir. It's always wonderful to have a conversation with you, so I'm really looking forward to it. I think I just want to congratulate the Government of India and the Ministry of Health for taking this issue as front and center, very important part of the conversation, and recognizing the need for work in this space in the primary health centers. From a health equity perspective, because PATH focuses on health equity, and there are many people who actually don't have access. So thank you so much. I think it's the beginning of the solution is actually recognizing the problem, and for me, the fact that we have recognized it at the national level, at multiple states, and gone down all the way down to communities, I think that makes a huge difference. Coming just from the question and the workforce perspective, it's a very interesting thing, but the same Deloitte reports that you just mentioned also kind of estimated that financial losses from conditions relating to mental health could be up to about $14 billion a year. Now we don't know whether these numbers are correct, but clearly there is an issue because of mental health challenges and absenteeism, attrition, etc. And there is a huge need for organizations, for companies, for societies. I mean, it's an important thing to actually recognize and start intervening.
Not think only about mental health, but we need to think about physical health, emotional health, and social health. And so we need to make a comprehensive strategy. And also, when implementing in different countries, different parts of India, we need to think about integrating evidence and modern protocols with the traditional or culture appropriate interventions. So, starting from the evidence, WHO has recently in 2022 made a guideline called Guidelines on Mental Health at Work. And we did a rigorous evidence review. Then WHO tried to make guidelines. It's a very lengthy process of going through all the different evidence. And we tried to come up with a concrete recommendation.
Your workplace culture and your inputs not only for the employees but also for the employers for the using holistic approaches for addressing the mental health issues.
Thank you. First of all, let me wish you all a very happy Navratri. This auspicious 9 days, and today is Ashtami. So it's a glorious day for all of us. We are a young nation, sir. Yes. And most of the people who are now studying in colleges and schools are going to be the leaders of tomorrow. So first of all, as everybody else has said, I think awareness is the first thing that we need to start with. Yes. Number two, this is the day and age of heavy social media with the youth. And when we talk about prevention, we are talking about that young population which is working. And they are day and night engaging in social media. So apart from Mr. Narayan Murthy, we also cannot have our top actors of our country. I just saw a YouTube video short of one of the top actors of our nation. I don't want to name him. He is like a heartthrob of the nation, and he's talking about that I don't eat and sleep, and that is how I attain success. So we need to somewhere be aware of what we are talking. Yeah, we need to, if we are leaders, yeah, we need to be aware of what we are speaking, especially in this day of social media. So there, as you said, leaders, people who are the inspiration for the youth, whether they are in the company, outside the company, Bollywood being the soft power, the politics, the politicians, everyone who's up there and leading the nation have to be made to be a little sensitive of what they speak and how they speak. And number 3, it is not about integrating yoga and wellness in the corporates. Yoga and wellness should become a way of life. It's about prevention rather than cure. Yes, we should be encouraging the employees, the workforce to go for regular annual detox. That's the only way. You know, you can't eat a homeopathy medication or an Ayurvedic medication if you've not detoxed the body and mind. So,
thank you so much, and thank you Ministry of Health and Family Welfare, and it's such an honor to be here amidst this esteemed panelists. So I have worked with hundreds of organizations for the last 20 years, and I have seen a span of different kind of experiences. I'm going to share some real examples from the companies. We've heard a lot of data from different external sources, a lot, and I'm not going to repeat all that. So one example I want to start off with is outside work, with your permission sir, is Finland. Have you all heard of this country, Finland? What is it known for? They're the happiest country in the whole world. And they broke a stereotype some time back. And what was it? Anybody? They had a youngest prime minister in the whole world, Sanna Marin, at the age of 34, a woman prime minister. And Finland was a country which had the highest suicide rates. And today they are one of the lowest suicide rates. And they have been last 5-6 years, they have been the happiest country in the world. And I know, you can go back and check amazing practices they have adopted. Human energy crisis that we are working towards, right? So how are we doing as corporates? As corporates, again, data says that one needs to have an EAP. What is the utilization percentage? It's as low as 2 to 5%. So there's a lot of stigma around mental health, right? And I'm going to just quickly talk about. Thank you so much.